Hello everyone, my name is Dr Treasa Kelleher and I'm a specialist in public health medicine working in the HSE National Immunisation Office. And I'm delighted to be here today to speak to you about vaccinations and steps to reduce your cancer risk. And I thank the organisers for inviting me to speak today. Next slide, please. Firstly, I'd like to briefly cover how vaccines work. Immunity is the ability of the human body to protect itself from infectious disease. And the defense mechanisms of the body are complex and include innate mechanisms that we are born with, and that includes physical barriers such as intact skin and mucous membranes, as well as others, and acquired systems. So vaccination or immunization is a simple, safe, and effective way that we can acquire immunity and protect ourselves from certain diseases. Next slide, please. Vaccinations can reduce the risk of some types of cancer by stimulating the immune system to protect against certain infections or diseases. This can then prevent us from getting sick from those diseases and also reduce our risk of later getting certain types of cancer that are associated or linked with these diseases or infections. And the two vaccines that I'm going to discuss in particular today are human papillomavirus vaccine and hepatitis B vaccine. Next slide, please. HPV stands for human papillomavirus, which is a group of more than 100 viruses. There are more than 100 different types of HPV, most of which are responsible for common skin warts. Some of these are low-risk types, while others are high-risk or cancer-causing types. HPV is very common, and most people will be infected with a form of HPV in their lifetime. HPV infection is most common in people in their late teens and early 20s. You can catch HPV by being sexually active with another person who already has the virus. And most HPV infections do not need treatment because your body can clear the virus itself. But in some people, the HPV infection can develop into cancer or genital warts. Next slide, please. What cancers can HPV cause? HPV causes 1 in 20 cancers worldwide. HPV can cause a range of precancerous lesions or abnormal cells in both men and women. Almost 10 out of 10 cervical cancers are caused by HPV. High-risk types of HPV also cause about 5 out of 10 cancers of the vulva, 6 out of 10 cancers of the mouth and throat or oropharyngeal cancers, almost 7 out of 10 cancers of the vagina, 9 out of 10 cancers of the anus, and almost 4 out of 10 cancers of the penis. Next slide, please. The HPV vaccine, called Gardasil 9, protects against cervical cancer and other HPV-related cancers. The HPV vaccine has been offered to girls in first year and secondary school since 2010. This is because the most common cancer caused by the HPV virus is cervical cancer or cancer of the neck of the womb. However, the HPV virus can cause other cancers and conditions that can affect boys. And since September of 2019, boys have also been offered the HPV vaccine. The more young people vaccinated, both boys and girls, the better the spread of infection can be controlled. Next slide, please. Over 140 countries and territories now give HPV vaccine as part of their national immunisation schedule, with more than 50 of these countries giving the vaccine to boys and girls. These countries include, but are not limited to, Australia, New Zealand, Norway, the United Kingdom, and the USA. There's more information about the success of these programs available on www.hpv.ie. The HPV vaccine is also recommended for people living with HIV up to and including 26 years of age, and for men who have sex with men up to and including 45 years of age. Next slide, please. The National Immunisation Advisory Committee has recently issued updated advice about the number of doses of HPV vaccine needed. NIAC now recommend 1 dose of HPV vaccine for people aged 9 to 24 years of age, 2 doses of HPV vaccine for those aged over 25 years old, 3 doses of HPV vaccine for people who are immunocompromised or have a weak immune system. First year in secondary school or as soon after as possible is the best time to get the vaccine, as it is most effective if given at this age. Next slide, please. Since HPV vaccine was licensed in 2006, research has been conducted all over the world that demonstrates that the vaccine is safe and prevents precancers. One study from England from November 2020 observed a substantial reduction in cervical cancer and the incidence of CIN3, which is severe cervical abnormality, in young women after the introduction of the HPV immunisation programme in England, especially in individuals who were offered the vaccine at age 12 or 13 years. And this study found that the HPV immunisation programme has successfully almost eliminated cervical cancer in women born since September 1st of 1995. The evidence has been steadily growing since 2006, and now a large bank of research exists which proves the safety and effectiveness of this vaccine. Next slide, please. The Department of Health has instructed that the Laura Brennan HPV catch-up vaccination programme offer HPV vaccination on a once-only catch-up basis to all who are still in school who were previously offered HPV vaccination in school and did not take up the offer, both boys and girls. And this includes in academic year 2022 to 2023, female students 2nd to 6th year in secondary school, male students who are in 2nd to 4th year of secondary school, or 5th year if they've skipped transition year. So they would have been in 1st year when the HPV vaccine was first introduced for boys in 2019 to 2020. All females who've left second level education and are under 25 years old on the date of vaccination are also eligible, provided that they've not already received the vaccine. Next slide, please. And this brings us to Ireland's roadmap to cervical cancer elimination. The HSE's National Screening Service, the National Immunisation Office and National Cancer Control Programme have joined forces to develop Ireland's roadmap to reach global targets for the elimination of cervical cancer. Launched on the 23rd of January 2023 to mark Cervical Cancer Prevention Week, this roadmap shows the stride made so far towards this global goal and signposts the future directions that we will take. The global goals have been developed by the World Health Organization and set key targets that all countries are asked to strive towards. And these include by 2030, 90% of girls should be fully vaccinated with the HPV vaccine by 15 years of age. 70% of women should be screened using a high performance test by age 35 and again by age 45. And 90% of those identified with cervical disease should receive appropriate treatment. Meeting these targets will put us on course to achieving our goal of eliminating cervical cancer as a public health problem in Ireland. Next slide, please. And this brings us to hepatitis B and cancer. Hepatitis B virus is an important cause of serious liver disease, including acute and chronic hepatitis, cirrhosis, and primary hepatocellular carcinoma, which is a cancer of the liver. Hepatitis B vaccine reduces the risk of liver cancer, and it is offered to all babies in Ireland at 2, 4, and 6 months of age as part of the primary childhood immunisation schedule. It's also offered to protect close contacts of people with hepatitis B, healthcare workers, and others at increased risk of infection. Approximately 20 to 25% of those with chronic hepatitis B virus infection develop progressive liver disease, leading to fibrosis, cirrhosis, and decompensated liver disease, and are at increased risk of developing hepatocellular carcinoma. Hepatitis B virus causes 60 to 80% of primary liver cancers. Next slide, please. Hepatitis B vaccines do not contain live organisms and therefore cannot cause hepatitis B virus infection. The vaccine is 80 to 100% effective in preventing infection or clinical hepatitis in those who receive a complete course of vaccine. And between 90 to 100% of vaccinated persons who develop an appropriate immune response after a primary series of hepatitis B virus vaccinations are protected from significant hepatitis B virus infections for at least 20 years or probably longer. Next slide, please. And here are some links for more information. Thank you for your attention, and I really hope that you found this information useful. Thank you.